We've come a long way in Sheffield in reducing smoking in pregnancy and now have the lowest rate in South Yorkshire. Each year, the Smoking Cessation Service helps many women stop smoking. However, 12% of women in Sheffield continue to smoke throughout their pregnancy. As we know, smoking in pregnancy poses significant health risks for both mother and baby, including miscarriage, stillbirth, low birth weight and preterm birth. Evidence shows that with professional help, women are 4 times more likely to stop smoking for good, and that the more pregnant women are routinely asked about their smoking status and that of their families, the more likely they are to make a quit attempt and to accept an offer of support. We all have a part to play in helping women, their families and partners stop smoking. It's everyone's responsibility to address smoking in pregnancy. It's important to ask pregnant women about their smoking status and that of their partners at every appropriate opportunity. As obstetricians seeing high-risk patients, we are able to deliver a very powerful message about quitting. We hope that this video will show you how quick it is to raise the issue of smoking with women and how easy it is to direct them to the support they need to enable them to quit.
It does not take too long to speak about smoking with pregnant women. We would recommend following very brief advice. This covers ask, advise, and act. It is important to convey the message that we are not being judgmental, but we are only trying to gather information. In Sheffield, we follow the NICE guideline, which recommends that carbon monoxide screening should be offered at every antenatal visit. If the carbon monoxide levels are over 4 parts per million, it is important to try to find out why it is high. It is very likely that the support worker would have checked the carbon monoxide levels before you see the patient. The first part of very brief advice is ask. Ask the woman if she is a present smoker or if she has smoked in the past. If she says yes, find out how her smoking habits have changed in pregnancy. If she says that she does not smoke, it could be that she is exposed to passive smoke. If her partner is with her, this could be clarified. If her carbon monoxide levels are very high, that is over 10 parts per million, and she and her partner don't smoke, please ask her to call the gas safety advice line. The second part of very brief advice is advice. Explain to the woman that stopping smoking has health benefits not only for herself but also for her pregnancy. Stopping smoking reduces the chances of miscarriage, preterm labor, and small babies, and sudden infant death syndrome. It's never too late to stop smoking, but the earlier she stops, the better it is for herself and her pregnancy. Explain that she would need to stop smoking rather than cutting down on the number of cigarettes she smokes. Cutting down means that she will draw on her cigarette more effectively because she will still desire the same amount of nicotine. This means that she gets more carbon monoxide in her body, which is the most harmful element. The third part of very brief advice is act. Once we have explained the benefits of stopping smoking, refer the woman on to the local specialist Stop Smoking Midwifery Specialist Service. Explain that this consists of one-to-one care with a local specialist midwife trained in latest techniques to help her stop smoking. This midwife can also help her with questions regarding her pregnancy and also tips to reduce her smoking craving in pregnancy. This service is free and hundreds of women have benefited from this. The midwife will give her a call to arrange a time and date convenient for her. If the woman declines to use this service, do not pressurize her into using it, but explain that if she changes her mind, it is always available for her to use. This service can be contacted either via telephone, by leaving a voice message, email, or via paper referral. Document this discussion in your notes and also make her aware that she can use it at any point in her pregnancy. Just to recap, ask, advise, and act.